On Tuesday, the Uganda Heart Institute broke ground on a new hospital complex worth $75 million, set to feature a 250-bed capacity, including 40 beds for intensive care. The state-of-the-art facility will include 3 operating theaters, 2 catheterization labs, an outpatient department, general wards for adult males and females, children's wards, consultation rooms, and other essential amenities. Dr. John Omagino, the executive director of the Uganda Heart Institute, highlighted that one of the key goals of this project is to reduce the 5,000 Ugandans who currently seek treatment for heart complications abroad each year.
If one person pays $5,000, no, $20,000 times 5,000, that is about 100. If they are operated at home at $5,000 per patient, that is $25 million. So there's cost saving if this place is put to full use. Should be able to deal with all that, cut short that losses, and that money can even help us to build other centers.
While the new hospital is seen as a significant investment that will strengthen the country's healthcare system, for Patience Masika, a mother whose 6-month-old baby urgently needs specialized surgery for 2 holes in the heart, the news is bittersweet. Holes in the heart are medically referred to as ventricle-septal defects and happen when the wall or septum that forms between the 2 ventricles does not fully develop. A ventricular septal defect increases the amount of blood that flows through the lungs. This forces the heart and lungs to work harder. Over time, if not repaired, a ventricular septal defect can cause the risk of other complications, including heart failure and high blood pressure in the lungs, among others.
So when we were discharged, everything was okay. After 1 week, the baby was sick again. So when we took her to the hospital where I delivered from, they took her to Nicho. She was distressed. She was put on oxygen. She wasn't breathing well. And the doctors told me the baby had Down syndrome. She's going to grow slowly. She's underdeveloped. That's why she's not breathing well. But after some time, when she was 5 months old, that was last month, January, her condition was worsening. So when I went to Mbarara Hospital, the doctors there said children with Down syndrome always have heart issues. So they decided to check her heart. Unfortunately, she had 2 holes on the left and the right. So they referred me to Uganda Heart Institute.
As a first-time mother, Masika is devastated. When she turned to the Uganda Heart Institute for help, she was told that her baby's case was beyond their current capabilities.
According to her condition, her heart can easily fail. So they gave her medicine to prevent that. And they told me she's not going to be operated here in Uganda because she's a small baby. So they need to operate her from abroad, India, basically, because the doctors there can operate small children. The cost of the surgery and everything is around 50 million Uganda shillings, and I cannot afford that money now. I don't know, but I cannot afford it. And I decided to come to NTV to call upon the public to stand with me.
Masika shares that she followed all the recommended care during pregnancy and after birth, yet her baby's health did not align with what was expected based on the baby's physical appearance.
It's really sad. You know, there are children who are born before her, and when you see them, they actually look older than her. She's 6 months, but you can imagine the way I'm holding her. You may think that maybe she's 3 weeks or 1 month old. To be very honest, from the time I had her up to now, I've never had peace of mind. It's traumatizing. If I knew it would be like this, maybe I would not have decided to, because it hurts, really hurts.
Her child is one of the 16,000 babies born in Uganda each year with congenital heart defects who urgently need life-saving surgery.
Okay, amongst the children, first of all, there are children born with congenital abnormalities, things like holes and persistent things in the heart. Two is rheumatic heart disease, that is an infection damaging the liver, damaging the heart valves and rest of the things. The other one is hypertension, leading to things like a stroke. And next is the coronary heart disease, where there is narrowing of these blood vessels due to cholesterol depositing in those vessels. Then you have heart failure, which is an evidence of failing systems.
Dr. Omagino assures that once completed, the new facility will significantly cut the cost of heart surgeries compared to seeking treatment abroad.
The policies that we are now requiring out of government is looking at facilities for physical exercise, both static within your house, within your compound, within the community. We get children go to school. No school should be open or given a certificate if it doesn't have adequate space for children to run, to do all the types of exercise. Look at people employing sites. All employees should have facilities for people to run, for people to do physical exercise. When we are planning roads and all these cities, they should have facilities and space for people to ride, for people to walk, and for people to do physical exercise.
But for Masika, the 2 years it will take to finish the hospital in Naguru feels like a distant hope. Her experience underscores a critical message: how much more needs to be done to prioritize and fund healthcare in Uganda. Walter Mwesije, NTV.